Have you ever found yourself hesitating before outings with friends or family because you worry about feeling uncomfortable, bloated, or constipated? For many of us in our late 60s and 70s, what used to be a quick and natural trip to the bathroom can suddenly feel like a major ordeal. It's a challenge that can sneak up on us, especially when we're juggling multiple medications, recovering from surgeries, or simply dealing with the natural slowing of our digestive system. Yet the good news is that with the right approach, we can address these concerns and regain the freedom to enjoy our golden years without constant worry. It's more than mere discomfort. Occasional constipation can affect how often you feel like heading out for a morning walk, or whether you're at ease joining a social gathering. After all, our energy, mood, and overall motivation often hinge on feeling good from the inside out. That's why exploring gentle, low-risk stool softeners can be such a game changer. These aren't harsh medications meant to shock your system. Instead, they're designed to work with your body's natural rhythm, offering relief and making day-to-day life a bit smoother. Some of us might believe that having less frequent bowel movements is just part of getting older. Others might be concerned that stool softeners are only for severe cases, but there are reliable, well-tolerated options that fit snugly into a balanced lifestyle, whether you're still enjoying a neighborhood stroll every morning or prefer quieter days at home. By discovering approaches that nurture your digestion in a gentle way, you might notice more energy, better sleep, or even a heightened sense of independence. After all, when you're not constantly worried about your bathroom routine, life feels a whole lot brighter. We'll look at 5 distinct methods. Each one targets a different aspect of healthy digestion, from adding natural sources of fiber to using mild over-the-counter aids that have been around for decades. Imagine feeling comfortable enough to say yes to that lunch date you'd usually skip. Picture waking up in the morning without dreading how your stomach might feel, because when you're over 70, small improvements can yield big results in confidence and well-being. I've spent years speaking with older adults about their health journeys, and I've watched many find relief by learning a few simple techniques for managing bathroom concerns. Although I'm not a doctor, I've seen firsthand how combining gentle products with a mindful diet and an active lifestyle can transform a person's daily experience. Of course, it's always important to talk with a healthcare provider about any changes, especially if you're taking other medications. Still, a basic understanding of what's available and how to use it carefully can empower you to make choices that fit your needs. Before we dive into these 5 low-risk stool softeners, I invite you to think about the difference it would make if you didn't have to stress about constipation again. How might it change your day-to-day life? Keep that vision in mind as we explore each gentle remedy. You might discover an approach that not only helps you feel better, but also reinvigorates your confidence for all the activities you love. Let's begin with something many people underestimate: the role of added gentle fiber in our daily routine. We often hear that fiber is essential, but there's a misconception that if you simply eat a bit more fruit or veggies, you're all set. While every bite of produce helps, the slowing digestive process many of us experience after 70 might require a more concentrated form of fiber to keep everything moving along smoothly. This is where psyllium husk, a common bulk-forming agent, can be particularly helpful. Many seniors assume that fiber supplements are only necessary if you have a specific digestive problem. But let's meet Margaret, age 72. She believed that her diet, which included whole wheat toast and the occasional salad, was already providing enough roughage. Yet she started noticing that her bowel movements had become irregular, often leading to discomfort and mild bloating. After chatting with her son, who'd begun using psyllium husk to improve his own digestion, Margaret decided to give it a try. She added just a spoonful of the husk powder, mixed into water once a day. In the beginning, it felt strange, thicker than normal water and a bit grainy. Margaret also worried it might upset her stomach, but to her surprise, within a couple of weeks, she felt a shift. Her bathroom visits became more predictable, and the bloating subsided. It wasn't a dramatic overnight change, but rather a subtle adjustment that gradually made her mornings easier. Now, Margaret says that even her energy feels more balanced, likely because she isn't dealing with that uncomfortable, stuffed feeling all day long. What's behind this improvement? Psyllium husk gently absorbs water in your intestines, helping to soften and bulk up your stool, making it easier to pass. This approach is often considered low risk, but you do need to keep an eye on your fluid intake. Water is crucial to help the husks swell and prevent any blockage. For many older adults, staying well hydrated is half the battle, so it's worth taking a few extra sips of water or herbal tea throughout the day. And of course, if you're on any medication, a quick check with your pharmacist or doctor can ensure there's no interaction with psyllium. What I love about Margaret's story is that it's a perfect reminder. Sometimes the gentlest solutions can be the most effective when practiced consistently. And consistency is often where we see real change. Rather than a one-off fix, it's a daily habit that can encourage lasting relief. If you've considered trying a bulk-forming fiber, think about the brand or type that's easiest for you to use. Some come flavored and some dissolve more readily. Start with a small amount and see how your body responds. Another tip, combine your fiber supplement with a new daily ritual to boost hydration. Maybe you have a glass of water with psyllium first thing in the morning or during your mid-afternoon break. That simple tweak can remind you to stay on top of your water intake, which helps with digestion overall. If you've used a fiber supplement before, have you tried adding an extra glass of water afterward? It's a small step with big benefits. Now let's move on to the second approach, docusate sodium. There's a persistent belief among many older adults that over-the-counter stool softeners are bad for you or addictive. While caution is certainly wise, especially if you're already on multiple medications, docusate sodium is well known for its mild, protective approach. Instead of forcing your muscles to contract vigorously, like some harsher laxatives, docusate works by helping your stool absorb more water and fat, softening it so it can pass more comfortably. John, who is 74, used to spend a lot of time worrying about painful bowel movements, especially after a hip surgery that left him less active for a while. He didn't want to rely on harsh laxatives, and he had heard rumors that taking a stool softener regularly could lead to dependency. His doctor reassured him that, with proper guidance and an understanding of his medication routine, using a gentle product like docusate sodium could ease his discomfort without causing long-term issues. At first, John noticed only a slight difference, but as the weeks went by, he realized his bathroom trips were far less stressful. That nagging fear of pain diminished, and he found himself focusing more on his rehabilitation exercises rather than dreading the next time he had to use the toilet. The best part was the peace of mind. He wasn't locked into a harsh routine, just a mild adjustment that gave him control over his comfort level. We often forget how closely tied our sense of independence is to these everyday bodily functions. When passing stool becomes painful, it can discourage us from going out, being active, or engaging with friends. Reclaiming ease in that area can have ripple effects across your entire well-being. Still, it's important to discuss any new product with your healthcare provider or pharmacist, especially if you're on blood pressure or heart medications. They can guide you regarding dosage and duration, ensuring it fits within your broader health plan. If you're worried about needing it forever, you can work with your provider to slowly taper off once your bowel movements stabilize. As with any product, the key is using it mindfully, understanding it's one tool among many to maintain healthy digestion. Before we explore the third low-risk solution, take a moment to think about your own experiences with over-the-counter options. Have you ever tried something like docusate sodium, but didn't keep track of how it impacted you over the long term? Sometimes writing down a short note in a notebook or phone about your daily symptoms can help you and your doctor figure out what's truly effective. It might also unveil patterns like whether certain meals or times of day influence your digestion. Next, let's consider a time-tested favorite, prunes. Some people hear prunes and immediately think of a stereotypical older adult food. There's a common misconception that prunes, or dried plums, are solely a last resort remedy for severe constipation. Yet for many, prunes can be a gentle, regular addition to the diet that keeps things moving without relying on synthetic products. The key is to understand their natural properties and moderate your intake to avoid overdoing it. Linda, age 76, grew up eating home-cooked meals but never really touched prunes until she experienced noticeable constipation in her mid-70s. A friend recommended she try a small serving of stewed prunes each morning, just 2 or 3 pieces, alongside her breakfast. Linda was skeptical, In her mind, prunes were something you only grabbed if you were in dire straits, but she agreed to try them as part of an overall plan to improve her digestion. For the first week, she felt no real difference. By the second week, she realized that her occasional straining had lessened, and she was heading to the bathroom more regularly. Beyond that, she discovered that prunes offered an unexpected sweet treat that helped her cut back on sugary desserts she'd been snacking on in the afternoon. Over the course of a couple of months, Linda found that a modest serving of prunes each day not only improved her bowel movements, but also helped her control her sweet tooth. The magic of prunes lies in their natural sorbitol and fiber content, which gently promotes bowel regularity. The biggest concern some folks have is accidentally consuming too many prunes and dealing with an upset stomach. That's why starting small is crucial. Just a couple of prunes a day can often be enough to notice a change. If you find they help, great. If not, you can explore a related alternative like prune juice. It's softer on the teeth and easy to mix into smoothies if you don't love the taste on its own. Additionally, prunes fit seamlessly into a balanced diet rich in vegetables, fruits, and whole grains. If you're worried about blood sugar levels, keep an eye on portion sizes. While they do contain natural sugars, the overall fiber content and nutrients can still be beneficial in moderation. As always, if you have specific dietary restrictions or chronic conditions, checking with a dietitian or doctor can add an extra layer of reassurance. If you've found any of these suggestions helpful so far, consider sharing your insights with a close friend or family member who might also be struggling. Health challenges like occasional constipation are more common than you might think, and talking about them openly can help break the stigma. Sometimes just knowing you're not alone in dealing with these day-to-day obstacles brings a comforting sense of community. Moving on to our fourth option, glycerin suppositories. The very idea of a suppository can make some seniors recoil, often because it feels invasive or uncomfortable. Yet glycerin suppositories are considered one of the milder, low-risk ways to encourage bowel movements, especially if constipation has become quite stubborn. They work locally by drawing water into the stool and providing lubrication, which can be a relief when you need targeted help. Meet Harold, 78, who after a prolonged hospital stay for pneumonia, found himself constipated from a mix of bed rest and antibiotics. He tried to manage it with fiber and a stool softener, but it wasn't enough to break the cycle. His doctor recommended a short course of glycerin suppositories to help jumpstart his system. Harold was hesitant. He'd never used anything like that before, but he quickly discovered it wasn't as uncomfortable as he'd imagined. The suppository was small, and the process was straightforward. A brief insertion, a few minutes of waiting, and then the urge to go came naturally. Harold used the glycerin suppository for only a few days. After that, he returned to a combination of gentle exercise and fiber-rich foods to maintain regularity. What he learned was that these suppositories could be a sensible solution when you need faster, localized relief that doesn't rely on your entire digestive system processing a pill or supplement. It's especially useful for those who struggle with swallowing multiple pills or who need to avoid certain oral medications due to interactions. One of the emotional benefits Harold experienced was the swift relief. He went from feeling physically uncomfortable and anxious about possibly needing more invasive medical interventions to discovering an easy, at-home method that empowered him. This kind of reassurance can make a big difference when you're already coping with health concerns. The main caution with glycerin suppositories, as with any intervention, is moderation. Relying on them daily for weeks at a time might signal an underlying issue that needs more comprehensive care. But when used as directed, especially under the guidance of a healthcare provider, glycerin suppositories can offer relief without some of the stronger side effects associated with stimulant laxatives. Before we look at our fifth and final option, take a moment to reflect on where you see yourself needing the most help. Are you curious about prunes but aren't sure how to incorporate them into your meals? Are you open to trying a fiber supplement but hesitant about potential bloating? Or maybe you'd like to talk with your doctor about a short-term solution like glycerin suppositories for those times when you feel stuck. Thinking about these personal preferences and concerns can help you decide which route to explore first. Finally, let's talk about polyethylene glycol, often labeled as PEG 3350. The name might sound a bit intimidating, and some folks worry about whether something with a chemical-sounding name can really be gentle. However, this is a widely used osmotic laxative considered relatively low risk when used correctly. Unlike stimulant laxatives that can cause cramping, PEG 3350 works by holding water in the stool, helping it remain softer for easier passage. Consider Diane, 69, who had struggled with constipation on and off for years. She tried fiber and dietary changes, but her constipation was sporadic, sometimes fine for a month, other times leaving her uncomfortable for days. At her yearly wellness visit, her nurse practitioner suggested PEG 3350 as an option to use when Diane felt a slowdown coming on. Diane liked that she could adjust the dose, and that it typically didn't cause sudden, urgent trips to the bathroom. After about a month of using PEG 3350 intermittently, she found a balance. A half dose every other day kept things regular without any unpleasant side effects. What surprised Diane the most was how much lighter she felt overall. Chronic constipation can cast a shadow over your mood and energy levels. And once that lifted, she felt more motivated to do activities she'd been avoiding, like joining a local Tai Chi class. One crucial point to keep in mind is that polyethylene glycol, like all stool softeners, should be used with awareness. If you find yourself needing larger and larger doses, or if you're not seeing improvement, that's a signal to consult your doctor again. Also, if you have kidney issues or other chronic conditions, it's essential to double-check whether PEG 3350 is right for you. In most cases, it's a safe option, but personalized advice is always the gold standard. By now, you can see that there's no single magic pill for everyone. Each of these 5 approaches offers different benefits and suits different lifestyles. Whether you opt for the fiber route, a gentle over-the-counter softener, prune-based relief, a localized suppository, or an osmotic solution, the key is recognizing that these methods are meant to support your body's natural process, not override it. As we bring this conversation to a close, it's important to remember that consistency and mindfulness are everything. One short-term fix might help in a pinch, but nurturing lasting habits like drinking enough water, staying moderately active, and making smart dietary choices can do wonders for keeping constipation at bay over the long haul. It's also valuable to maintain open lines of communication with your healthcare team. If something feels off or you're uncertain about a new product, don't hesitate to ask questions. Your comfort and well-being are worth that extra bit of effort. If you follow this discussion, you already know more about stool softeners than many people your age. But knowledge alone doesn't lead to change. It's the step you take next that matters. Maybe that means heading to the grocery store to pick up a small bag of prunes, or calling your pharmacist to check on a suitable dose of psyllium. Or perhaps you want to set up an appointment with your doctor to talk about something like PEG 3350 if other methods haven't worked. Small actions taken regularly can accumulate into significant improvements for your daily life. This isn't about rushing into anything out of fear. It's about recognizing that our bodies are always adapting as we age, and we can adapt alongside them. You have the power to explore and choose what feels right, to fine-tune your approach until you find that sweet spot where you're confident and comfortable. Picture waking up without dread, looking forward to a day free from the shadow of digestive troubles. I invite you to pick one strategy from this conversation and make a plan to test it out. If you want to start with the mildest option, perhaps that's adding a little more fiber or trying a prune or two with your breakfast. If you need more immediate relief, you might talk to your doctor about glycerin suppositories or a gentle stool softener. Whatever you decide, promise yourself you'll do it thoughtfully, track how you feel, and give it a fair trial. And if you found this information helpful, share it. You never know who else might be quietly struggling with the same issue. Offering someone else a pathway to relief can create a supportive community around healthy digestion, a community where everyone feels comfortable discussing what truly makes a difference in their well-being. Here's to embracing small, simple shifts that can make daily life easier, more comfortable, and more joyful. You've come this far in life with plenty of wisdom, and taking care of your body's basic needs is a natural extension of that wisdom. In the end, it's about finding balance, protecting your sense of independence, and living the way you want, without your digestion dictating your plans. You have the insight, the tools, and the gentle remedies to help you thrive. Let's keep that momentum going together.